The erroneous topic that I have chosen is that mental illnesses such as depression are considered to be solely caused by chemical imbalances in the brain. The erroneous or misleading advertisement I have chosen is this article about serotonin and how neurotransmitters directly affect your mental status with depression, with specific focus on the serotonin depression versus dopamine depression section. There is a specific infographic talking about different types of depression and how they are different, all depending on the type of neurotransmitter imbalance that stands out the most in this article. This infographic is misleading because neurotransmitter imbalances are not the sole cause of depression or mental disorders. The first article that I've chosen is titled Comorbidity of Depression and Diabetes, an Application of the Biopsychosocial Model. This states the predictors as to why someone develops or could develop depression. Usually there are aspects from multiple areas and not just one, and this article discusses the comorbidity of people with type 2 diabetes and depression. The article found that many different biopsychosocial factors can cause depressive symptoms to arise or worsen. These factors include complications with their health or diabetic complications, a lack of emotional support in their home life, stressful occupation, or a traumatic event in their life within the past 6 months. There are some biological causes of depression where neurotransmitters may be at least partially responsible for the development or worsening of depression. There are many different ways neurotransmitters can be tied to mental disorders as well as treated with antidepressants, but there are sometimes other biological factors to consider treating that may be an underlying cause of the depression. The second article that I have found is titled, There Are Always Two Sides to These Things, Managing the Dilemma of Serious Adverse Effects from SSRIs. This article talks about how there are pros and cons to almost every form of treatment for a mental disorder, but the ones with the most serious side effects tend to be selective serotonin reuptake inhibitors, or also known as SSRIs. While they may be used to help treat depression, they can also severely worsen the symptoms and create new ones. With adverse reactions such as suicidal thoughts and tendencies and aggression, as well as many more, there is a controversy over whether SSRIs are more helpful or hurtful when treating depression. Since there is not always a biological or medical cause for depression, there is not always a biological or medical form of treatment needed to influence neurotransmitters. The treatment for depression are usually more effective when you combine cognitive behavioral therapy and medication, but CBT alone or medical treatment alone with SSRIs are not always the most effective treatment. Every case is different, and each course of treatment must be tailored to the individual to see which treatment will best fit them, but medications such as SSRIs are not the only treatment, as neurotransmitter imbalances don't apply to every case. A common treatment and alternative to SSRI medication is cognitive behavioral therapy, and is usually considered the most effective. The third article that I found is titled, Impact of Inflammation on Neurotransmitter Changes in Major Depression, an Insight into the Action of Antidepressants. This article discusses how there are connections between chronic inflammation and endocrine and neurotransmitter systems that are not functioning properly that are strongly tied to depression. There are theories that antidepressants and anti-inflammatory drugs may have similar effects in alleviating the symptoms of depression in these cases. There are still great variances in these cases depending on environmental and genetic backgrounds and the patient's personality and lifestyle, as depression is not solely a result of biological changes or neurotransmitter imbalances. There are many possible causes of depression that are not biological in nature. The theory that neurotransmitter imbalances are solely responsible for mental illness, such as depression, is not proven, and it is a great misconception clearly represented in the erroneous infographic in the misleading article presented. The fourth article that I found is titled, Predicting Whom Benefits the Most from Cognitive Behavioral Therapy for Anxiety and Depression. This is a study to analyze how patients are suitable for cognitive behavioral therapy and how that correlates with their outcomes. The study used the Suitability for Short-Term Cognitive Therapy scale to test this, and found that one factor of the scale correlated that a patient's ability to actively participate in the therapy was essential to their success. The fifth and final article that I found is titled, Misconceptions about Depression and Its Treatment. This article discussed how there are many misconceptions about depression in the media around the world that are untrue yet supported. Some of the true facts about depression that aren't widely known are that depression is considered to be a mental disorder and not an illness. Also, the biological cause of depression is not completely proven, as life experiences, both negative and positive, are more likely to influence someone's likelihood of developing depression, as opposed to the theory that neurotransmitter imbalances are the sole cause of depression.